All right, for my ladies who have had a hysterectomy or you're about to get one, I want to take you through some of the most magical types of recovery exercises that can be helpful for supporting your core and your pelvic floor. One of the types of exercises that I rave about because it's really going to address some of those weaknesses that you may have after this type of surgery. My name is Dr. Dawn Andalone. I'm a Pilates instructor, women's health specialist, pelvic floor, physical therapist, and working with women who have had a surgery, especially a hysterectomy, can come with a lot of questions, a lot of unanswered questions. I'm here to guide you in the right direction, and when it comes to that post-visit or post-surgery visit with your doctor, with your surgeon, and you have a lot of questions about what activities you can start next, but when you're safely cleared for exercise, these are going to be some of the top things that you should focus on. Now, not all Pilates is the same. You want to be guided by someone that is an expert, knowing how this area heals and recovers. But therapeutic Pilates or Pilates-based exercises can be a great way to get back into building the foundation of your core and pelvic floor and helping that recovery process. So today in this video, we're going to talk about my top Pilates exercises for post-hysterectomy care. And if you have any other questions about hysterectomy, recovery, you can go back and watch a lot of my other videos on this channel too, where I dive into some of the most common questions that I get. Now, Pilates, like I mentioned, great for the core, great for pelvic floor muscles down here. And those muscles support your bladder now that you had a hysterectomy. And also those muscles are helpful for returning to sexual function, for supporting your whole pelvic area, especially when you're walking, jumping, moving around. And learning how to activate those muscles and learning how to relax those muscles can be very helpful after a surgery or after undergoing any kind of trauma to that area. Now, giving yourself the best amount of time to recover and heal. Just know every woman is going to be very different after this type of surgery. But when you are cleared safely by your doctor to start some gentle activity, these are going to be some of the top things that I would focus on. So not only does Pilates help with your core strength and your overall posture and the way that you're holding your body in space with your alignment, it is also going to get you to connect your brain to your muscles, which is highly effective and different from any other type of exercise. All right, we're going to start on our back, and you want to place your hands right over your lower pelvic area. So if you had an incision here, or if you have little portal sites, this area may be a little tender still, which is totally normal, but working on some deep breathing exercises, kind of that foundation of Pilates exercise, can be very helpful for healing. So you're gonna take an inhale through your nose, exhale through your mouth, and as I talk you through this, you're gonna go through 5 good deep breaths. Inhale through the nose, exhale through the mouth. Your hands are here because you want that inhale to kind of fill your belly. You'll feel a little rise of your stomach and then a little fall of your stomach toward your spine, just slightly on your exhale. So keep going. Let's do 2 more. Good. Inhale. Feel those abdominals kind of push into your fingers a little bit and then gently soften the belly on your exhale. You're not engaging any muscles. We're just working on trying to get that breath down into the pelvic region and the lower abdominal region. And this helps be able to release any unwanted tension or pain. Very safe and easy to do. Now you can do a round of 10 to 15 of these. Good to do a couple times a day, but that just helps you reconnect with this area in your body. Next, we're going to try just some gentle little movements of your hips and your pelvis. So we'll take that inhale through your nose. As you exhale, think of a little pulling in, a little hug of those muscles, like your navel's pulling in toward your spine.
And we're gonna press our back just a little bit to the mat. So a little pelvic tilt with a little lift of those abdominal muscles. Good. Inhale, release those muscles. Go back to neutral. And then exhale. We exhale and we hug those muscles in a little bit under your fingertips and press your back gently into the mat. Little pelvic tilts. So we're gonna do 5 of these. Do them with me. And you don't want to think of tensing and tightening your glutes too much, your butt muscles. We want to release and then exhale. Little press toward the mat. Good. Once you are done with 5 of those, just kind of let everything release in your lower back. Let your hip and your pelvic muscles relax. And those were the first 2 exercises. So we have the diaphragmatic deep breathing, and then the pelvic tilt with a little abdominal drawing in. So those 2 exercises are great basic ones to start with. Now next we're gonna progress to something that's a little bit different and works more the hip muscles and lower back, which all these muscles are connected and help support your midsection after a surgery. So we're gonna add on. You're gonna take an inhale. And as you exhale, do that pelvic tilt and the little hug of those muscles in toward your spine. And we're going to peel our spine off the mat up into a little bridge. And then gently release all of those muscles. Let everything relax as you lower back down. So we're doing more pelvic tilt to a bridge roll up through your spine. Your back may feel a little stiff and achy after a surgery. So this is a great one to get a little more movement in your lower back and also engage through those muscles where you're hugging in toward your spine and using your core. Good. We're going to do 2 more. Please stop if this is uncomfortable or anything is hurting. You don't want to feel pain with exercise. Maybe it's a little challenging, but it shouldn't be painful. Should feel good that you're moving your body. So if you're having any pain or discomfort, then you definitely want to slow it down and just go back to the breathing exercises and some walking. Okay, we did 5 of those bridges, so go ahead and let everything completely relax, let it go. And from that bridge, next we are going to turn over and I'm going to show you one other of my favorite Pilates exercises on all 4s. So it's good to change positions because that way you're learning how to use your muscles in different positions, which has to happen through your daily life. We don't always stay in the same position. So on all 4s, my shoulders are right over my wrists, my hips are over my knees. And if you can't be down on your knees, I'll give you a variation, so stay tuned. But from here, we take an inhale. We keep our spine nice and long. Let the belly muscles soften and relax. And then as you exhale, draw those muscles in toward your spine, hugging them in just like you did on your back. And we're going to extend your opposite arm and leg for a little balance. And then we're going to bring it back in. Let those muscles go, release. Take an inhale. As you exhale, draw them in, hug the belly toward the spine, and then extend the opposite arm and leg and pause. So we just want to hold it out there for a second or 2 while you keep these muscles engaged. So we're going to repeat. You can keep moving, and you're going to do 5 on each side. Now a variation, if you're having trouble kneeling, so I'm pretend like this is your countertop in your kitchen. So we're going to be in this angled position here, and from here you can just work on pulling the navel toward the spine as a little hug. It's almost like you're in an angled plank position, just enough that you let the muscles go and release on your inhale, and then exhale, hug those muscles in toward your spine. You can either add a little leg lift without moving your back, a little leg lift on each side while you engage the core and pull those muscles in.
Okay, there you have it, my intro to Pilates, that top 4 exercises that are safe to start once you've been cleared by your doctor to start with, that are going to give you just a good foundation of a little routine you can follow. I have a full-blown pelvic floor Pilates full program that gives you videos that you can do every day of the week, and it's only 15 minutes a day, but gives you more of a full body approach and full body strengthening routine, including some stretches, exercises that are not going to be found anywhere else, because we're going to address the pelvic floor muscles, which is super important and not really in a traditional Pilates type of video. But the pelvic floor is so helpful for avoiding leaks and incontinence problems, plus making sex more enjoyable, and also helping with back pain. Your pelvic floor is a big part of it, and those core muscles and the pelvic floor, how it all works together. So that's my more specialty program. I'll put the link right below, but pelvic floor Pilates. And therefore, after a hysterectomy, you want to find the expert guidance and be able to have exercises that you can do that are safe to do, but also they feel like you're getting somewhere with strengthening this midsection of your body. Not always found out there, as there's not a lot of info for women after a hysterectomy, what to do with fitness and recovery. So you want to build a good foundation, and you want to do it in a way that is therapeutic for your body with your pelvic floor and your core. So go check that out. Anyway, I hope you enjoyed this video. I have a lot more helpful videos on this channel, and if you'd hit subscribe, you can be notified when I release new ones. And happy healing. I wish you the best in your recovery from your hysterectomy. So best wishes, and we'll see you again in another video.